Well, I think what we'll do is we'll go ahead and get started with some backgrounds. Those of you that are here, thank you very much for joining us. As many of you know, BirchBark Foundation is a Central Coast organization that works hard to help people whose pets have catastrophic or life-threatening illnesses, and we do medical grants to help with them. We also do grief support in the community and education for pet owners. And you're here as part of our education webinars. We're doing quarterly webinars. One of the slight silver linings with the COVID pandemic is we really realized that we could reach more people by doing online webinars. So tonight, our topic is scratching, itching, and skin disease in our pets. And I'd really like to welcome Dr. Chris Lewis. Dr. Lewis went to vet school and undergraduate at Kansas State University. He also practiced a small animal clinician in Las Vegas for about 10 years, and then went back to school to get a master's in public health, and is a diplomat of the American College of Veterinary Preventative Medicine. And tonight he's going to help us understand more about skin disease in our pets. Thank you for joining us, Dr. Lewis.
Yes, Dr. Birch, thank you for having me. I'm really looking forward to this discussion. And I believe I'm going to go ahead and take off me from the video. It just actually makes my bandwidth a little better, so I don't want to try not to have any jumpiness as I present. But I believe there is the kind of the chat function if you do have questions. If you want to put those into the chat, there's also, if you want to put those in there, and I believe we will try to get to the questions at the end of the presentation. And hopefully I'll cover a lot of the concerns. But if there's something that comes up, or if you want a little bit more detail, then we'll try to get to that at the end. Okay. So as Dr. Birch said, my name is Chris Lewis. I'm a technical services veterinarian with Vetoquinol USA. And I did practice in small animal practice for over 10 years. And dermatology is definitely something that we see on a daily basis. All animals have skin. And it is very common to run into skin diseases. And so what we're kind of touch on today is nothing too deep because that's something that there's a lot of information out there. But I want to try to give some background on some common skin conditions and give an idea of kind of what to expect if you visit your veterinarian to try to figure out what we may be dealing with. And then just a little bit of background on some of the common diseases as well. So that way you're prepared when you do need to go see your veterinarian. And away we go. So tonight I'm just going to cover a few basics of dermatology, some common terms, and some things to kind of keep in mind. We're going to discuss some ways to help you help your veterinarian, help your pet, because that is something that veterinarians rely on our pet owners to really be able to help us, really help your pet. We're going to go over some of the common itchy skin conditions, and then we'll have a brief summary at the end. So the skin, when it comes down to the architecture of the skin, their architecture is very similar to ours, just a lot more fur. And so some of the same conditions that animals have, people have as well. We just have partial fur coats. So there are a few common dermatology terms that I wanted to cover. And with veterinarians, we use technical medical terms often, and we don't always mean to do that. We don't want to necessarily kind of be confusing. It's just these are some of the terms that we're used to using. And so some of the most important things to think about is something like dermatitis. It's a general term for skin inflammation. It can have many causes. So dermatitis is just kind of an umbrella term for inflammation of the skin. Lesion is an animal that there is some type of disease. Pruritus is severe itching. Alopecia hair. Pyoderma is a skin infection with formation of pus. And then atopy is one that we'll get into a little bit later on. But this is something, atopy or atopic dermatitis is actually where the animal has a genetic disposition to develop an allergic reaction and produce elevated levels of IgE, which are inflammatory, upon exposure to an environmental antigen. So this is kind of like environmental allergies, and this is one of the common things we deal with. And then otitis would be inflammation of the ear, and this is more about itching, but neoplasia, which is kind of a cancerous lesion, that's something that is sometimes something that we're concerned about, but really not to get into that on this one because it's less common for neoplasia to be a concern with itching. And I will apologize. I too have environmental allergies. And so sometimes I get a little bit of a scratchy throat this time of year. So, so I apologize in advance if I have a little bit of a raspiness as I go through. On this slide, we're going to really shows us some of the common reasons that pet owners take their pets to a veterinarian. This is back from 2018, but if you look at the various lists over the years, they're all pretty similar. These conditions might move up or down a few spots. For the most part, for dogs, allergic dermatitis is always otitis externa is an ear infection. Benign skin, it's not a spreading or really as problematic type of tumor. Atopic or allergic dermatitis is way down here. This we do see in cats, but it's definitely, cats usually skin conditions. So we'll be focused on dogs because it's just so much more common. And there are a few kind of, I guess when I was in practice, some basic things that I wanted to kind of help pet owners realize, so that way we're all on the same page moving forward and trying to help my patients. And when it comes to managing skin issues, the longer a skin issue is present, the longer it may take to resolve. So it is best to act sooner than later. If a condition has been going on for weeks or even months, then it can take weeks or even months to get it to resolve. And so if we notice something, it is better to act sooner than later. That way we can try to just make it less problematic for the patient and also for yourselves. There are some skin conditions, and here I'm really thinking of allergies, that are not cured, they are managed. And so that is an unfortunate reality with some of these issues, is that we may not fix the problem, we're just trying to minimize problems, and it's something that we're probably going to be dealing with for the life of our patients. So, we're not always able to cure them, but we want to do our best to keep them as comfortable as best we can. And then most of these skin conditions can be managed by your veterinarian, your general practitioner. And so we want to partner with them to help your pet. There are definitely some things that are uncommon or more, I guess, tricky to manage. And that's where a veterinary dermatologist might come into play. But many of the diagnostic tests that I'm going to discuss and many of the therapies can be done by your general practitioner. And some are happier to deal with skin than others. It's kind of one of those niches that some people really enjoy and some people don't enjoy it as much. But it is something that, you want to definitely have you partner with your veterinarian so that way everyone can work together to help your pet. So to kind of springboard off of that, there are some ways that we can help your veterinarian help your pet. So help me help you help your pet. And that's a lot of helping going on, but that's really what we need, especially with skin disease, because of, as I mentioned, it can be a tricky thing to get under control. So really what my hope is that all of us are our pet's best advocate. And there are some things that you can do to help be that for your pet. And this is something that I always recommend my patients do. It's something that I try to do when I go see my doctor, because we all have been there before where it's like, okay, I'm going to ask this, this, and this. Then you get in the exam room, and for whatever reason, you completely blank on what you want to ask. And so what I recommend is to write down your questions before your visit, and then ask the questions or share them with the veterinarian or the staff. And it kind of depends. Every clinic kind of has their own protocols on who they see when. Do you see the technician first or the veterinarian? And especially with our current situation, sometimes you can't see them live. You have to do it, drop your pet off. So it is something that trying to be prepared so that way your questions can be shared. And then if you think of more questions during the conversation, ask them. Write them down if you have to, but this should be a conversation. Hopefully it's not going to be a one-sided type of discussion there. But also remember, veterinarians, we are also your pet's advocate. We took an oath as a veterinarian when we started the profession that our goal is to help our patients, and we want to do that as well. But you got to work with us a little bit. It may take several tests to figure out what the skin condition or skin conditions we may be dealing with. And so it may not be looking at your dog and we know the problem. There are some other diagnostics that we'll likely need to do to try to narrow down what we're truly dealing with. So it may not be that an answer we have in 5 minutes. It could even be that we come to multiple diagnoses over time. But we also want to fix the problem. If we can fix it, we definitely want to. We love seeing our clients, we love seeing our patients, but we want to see them healthy. And so if we can fix the problem, we will. But we also get frustrated when things don't go as planned or don't go as expected. And with dermatology, this is unfortunately one of those areas where things don't always go as we think they should. And as I mentioned, since some of these things we can't cure, then it can be something where we think we have everything going well, and then we have an allergy flare, and then now we're dealing with that. So it's not just you. We also can get frustrated when we think we have things on the right track. Ways that can be really helpful, and this is something that with some of the technology and things that we have available, this can be a way that you can really help your veterinarian by providing some critical information. And one of the best of those is pictures. And so pretty much everyone has a smartphone, or I have more than one because I have my work one and my personal one. But what we can do is we can take a picture of the area that's of concern. And then if we can put a ruler in that picture, it can give us an idea of of the size of that lesion. So this is actually the top of a dog's paw. And we can see this is actually centimeters. So this is actually about a 5.5, 6 centimeter size lesion. And this is something that, especially if we notice a spot and take a picture with it, and then, okay, a week later, we take another picture. Is it getting bigger? Is it getting smaller? And this is also true with those skin lumps and bumps that most animals get as they get older. Taking a picture of those and kind of logging that in your phone can allow us to see, okay, is it something that's slowly getting bigger? Did it dramatically get bigger? So pictures can do a lot of good for us. And I know this is kind of dinner time. I try to choose a relatively not too bad picture here, but this is moist dermatitis on the top of a dog's paw. But another thing that can be very helpful is taking notes or even a diary of what you're seeing at home. You can write it out. You can do it on your phone. You can type it up on Excel or Word or whatever works for you. But if we can do some notes to see, when did the problem start? Has it gotten worse or better? Is there a time of day or time of year that it's the worst? Because that can be allergies, or it can sometimes be other environmental cues. Is there something that changed at home? So we have new food, new pet, new bedding. We've moved. All of these things can have a pretty dramatic impact on managing this for our patients. And then really one of the big things is what foods, treats, medications, and activities does the pet do? Because we might say, yes, the dog gets X dog food, but then they get a lot of table food, and that can introduce other potential food allergens and things like that. So again, as much information as you can provide the veterinarian, that's going to help make it easier for them to try to narrow down the possibilities and hopefully make it more of an efficient process of elimination. But there will be some diagnostic tests that are often needed to try to diagnose what we're dealing with. And not all of these will be needed in every visit. It often starts out with some of the basics and we move forward. But what we're typically going to start with would be our simple physical exam. What do we see on the pet? Where on the pet are the problems? Is it the ears? Is it the paws? Is it all over? So the physical exam, including looking down those ears, is going to be something that we'd want to do as in all cases. Cytology is actually where we might press a microscope slide up against a skin lesion, like if there's a pustule, then we might kind of pop that and put that on a slide. And then we'll look at that under the microscope to see what type of cells are present. Are they a bunch of, these are neutrophils, which indicate infection. Are we seeing bacteria? Are we seeing yeast? What are we dealing with? Because this is one that's really key in helping us determine what type of therapy we might need. Then we have a skin scrape, which is like it sounds. We scrape the skin. And this is going to help us look to see if we can find parasites in the skin. And so, unfortunately, it looks a little rougher than it. We actually have to scrape the skin till there's a little bit of blood, because those parasites like to hide deeper down in the skin layers. So the animals do okay with it. But that's to help us rule out some types of parasites. We have our Woods lamp, which can help us identify ringworm. Our DTM culture also can help us identify other types of fungal infections. Blood work. This is going to be important for some of our patients because an underactive thyroid or hypothyroidism can predispose to various skin conditions. So can Cushing's disease, diabetes. There are several things that we can help determine if it may be contributing to some of these skin problems. Then we have our biopsy with histopath. If we have an area that looks really strange, or if we've done a lot of other therapies and it's not responding, then we might need to do a biopsy with histopathology, where a pathologist looks at it to determine what's truly going on. And actually, it's gotten to the level now, skin disease can be so complicated, they're actually dermatohistopathologists. So these are pathologists that are specialized in dermatology or skin conditions, because they can have such subtle changes that can help point towards allergic skin disease versus something more problematic. And then another thing that we might end up doing is a culture sensitivity, or a CNS, where if there's a little pustule on the skin, then we kind of pop that open. We take a little swab of that area, put it in into a growth medium, send that to the lab, let them grow bacteria, see what bacteria it is, and then determine which antibiotics are going to be appropriate. And so this is going to be every time the physical exam. Cytology, a lot of the time, some of these, though, might be in the initial stages and then progress if we see that the animal's not responding as we expected. So now we're going to touch on some of the common itchy skin conditions in our pets. And this is something that's sort of a joke, what keeps you up at night. But in all honesty, that's a lot of times when an animal is finally brought into the veterinarian, because now that dog is scratching all night long, or chewing, or licking, or doing those things that keep us up at night. And so it's sort of a joke, but it's actually very, very common that first night that you can't sleep through the night because your dog is scratching. We often see the animal or get a phone call the next day. So I'm going to have some kind of basic information for each of these. Again, I'm not going to go into great detail because I could talk for a long time on these, and that's not what we're here for tonight. But I wanted to give you some kind of basic information on some of these common issues that lead to itching and scratching. So flea allergy dermatitis. So dermatitis, again, inflammation of the skin as a result of flea, and it's really the saliva that when the flea bites our animal, then they basically inject saliva underneath the skin, and these animals have an allergic reaction to the proteins in that saliva. And so it's most commonly over the flea triangle, which you can kind of see on this dog, where it's the middle of the back, over the base of the tail, and kind of down the back of the legs. A similar area for cats as well, but cats will sometimes have it kind of over the neck and maybe the head as well. But usually they're licking, chewing, scratching. And then what we're going to do for this is, well, the easiest diagnosis is we see the fleas. And usually that's the case. But sometimes, if even just one or two flea bites can be problematic for an animal if they are that reactive. And so there's other things that we'd want to rule out, other conditions that could be contributing to it. But usually we're going to be looking at the clinical signs and in the physical exam. Again, if we see this, we're definitely thinking flea allergies, and then we would typically treat them with appropriate parasiticide to kill those fleas. And if they respond, then yes, it is flea allergies. But when we're treating it, we want to do strict flea control for all pets and the environment, because unfortunately fleas can be so problematic and they can be difficult to eliminate from an environment. So typically we're going to have them on flea control products for the rest of their life, so that way we can minimize any flare-ups there. But we'll also want to treat any secondary conditions because inflammation of the skin can allow other infections to come on board. And I should have touched on that earlier. On the skin, there's always yeast and bacteria. It's normally there, just like us on our skin. There's yeast and bacteria, and when the skin is healthy, no big deal. They just hang out and they just are on the surface. But if the skin gets damaged, whether that's a cut, whether that's scratching, whether that's moisture from licking, whether that's a flea bite, once that skin is damaged, then that can potentially allow yeast or bacteria to cause an infection. And so we can have a primary issue like flea allergy dermatitis that can lead to a secondary pyoderma as a result of the damage occurred from the flea bite, causing the inflammation, causing the dog to lick, scratch, and chew, causing that inflammation and that nasty cycle. So once we get the fleas under control, that helps quite a bit. But if we have a secondary infection, we need to treat that as well. Then atopic dermatitis or atopy, I had mentioned that a little bit earlier. So this is kind of what we consider more of an environmental allergy. So it can be plant pollens, it can be house dust mites, mold spores, other environmental allergens. Animals can be allergic to human dander. Dogs can be allergic to cat hair. They can be allergic to a lot of things. And the tricky part is what we see with this is what we see with a lot of other conditions. So they're licking, chewing, scratching, or rubbing areas that are affected. But these are the areas that we're often thinking of, around the mouth and eyes, kind of on the legs and paws, on the belly, maybe around the back end underneath the tail. And it can be seasonal if it is a plant allergen that's outside, but it's not always seasonal because, well, like some areas of the country, plants don't die. I'm in the Midwest, and so in the winter, plants die. So seasonal allergies are definitely a spring and fall thing, like I'm dealing with now. But areas of the country where plants are alive year-round, this can be a year-round issue. Or if it's something in the house, then most of the animals are in the house year-round, so it can be a year-round condition as well. And with atopy or atopic dermatitis, we're going to rule out other common skin conditions. Again, this is what we're doing with a lot of these, is ruling out infection, ruling out parasites, trying to determine where the problem is. And then to really understand what we're dealing with, allergy testing can be performed to figure out what allergies or what the allergens are that are triggering this problem for the pet. Really, unfortunately, this is a condition we don't cure, we manage it. And so we want to try to avoid or reduce allergen exposure. Avoiding being outside when it's at its worst, which can be difficult with an animal. But things like frequent baths to remove those pollens or environmental allergens from the skin and hair coat. There's medications that can help manage the effects of atopic dermatitis. And then you can actually do allergy therapy, whether that's injections or sublingual drops, to try to reduce that allergic response, similar to what happens with people. And then again, common theme here, if there's any secondary conditions, we want to treat those as well. And then next up, we have food allergy dermatitis. And if you'll notice, very similar to what we saw with our atopy. And this can be where it's tricky to try to figure out, is it food allergy? Is it an environmental issue? Could there be both? Could there also be a flea issue? Yes, we can often have a combination of each of these. But with food allergy, it's usually it's an allergic reaction to a component of the pet's diet. Proteins are the most common, so beef and chicken are kind of the most common. We can see gluten, we can see various carbohydrates, and even some additives to the food can be that trigger. But again, we see the similar effects of what we saw with atopy. But with cats, we often see that with cats with allergies, they're often, seems like often bothering with the head and face more. We can still see the rest of the body, but with cats, for whatever reason, a lot of their allergies are focused around the face and the head. So we're going to roll out those other common skin conditions, and then typically we're going to do a hypoallergenic food trial for 8 to 12 weeks. And basically that is something that the animal has never had before, or a type of protein source that should not be problematic, and then see if the condition gets better. If the scratching and itching goes down, then we can either just stick with that food or potentially add in ingredients that we think could be a problem and gauge their response. But this can be managed with a novel protein diet to avoid that allergen exposure. There's certain medications that can be used, like steroids or other things, if it gets really bad and we really need to help get that inflammation under control. And again, treat any secondary conditions. Then otitis externa. So this is an ear infection, very common in dogs. See it in cats from time to time as well. But with dogs, otitis externa is the outer portion of the ear canal. So it's kind of from the eardrum out is where the kind of the otitis externa is. And so this can be secondary to something that has damaged the normal structures of the skin. Allergies are the most common because allergies cause inflammation of the skin. That inflammation damages the normal defenses of the skin. That can allow yeast or bacteria to come in and cause an infection. But it could also be a floppy-eared dog that likes to swim. So labs that are always in the pool or always in the pond or out here in the ocean, then that moisture can get trapped in those ears, and then that can lead to an infection. We're usually going to see them shaking their head, scratching their ears, rubbing their ears, and it can definitely be very painful. And then we might notice discharge and or odor, especially as it gets worse and worse. We can start to get kind of a funky smell going on there. We're going to diagnose this by looking at the ear, and we're going to look down the ear with a kind of a scope to kind of see what things look like deeper down in that ear canal. And then this is where cytology really comes into place. So we take a swab of that gunk in the ear, we put it on a microscope slide, look at it, stain it, look at to see, is it yeast? Is it bacteria? What type of bacteria? Is it both yeast and bacteria? So that way we can determine what we need to do to treat them. Is it antibiotics? Is it antifungals? Is it steroids? Is it all of them? So that'll help us try to figure out how we need to manage that. But again, we want to try to manage those primary conditions. But it can be a very recurring problem, especially if we can't cure that primary cause, like being a lab with floppy ears or those allergic animals. In pyoderma, as I mentioned earlier, this is where we have a skin infection to where there's pus present. And so this is the belly of a dog with several pretty large, these would be collarettes, areas of infection with kind of crusted pus that is developed. Usually these are secondary to damaged skin barrier. Again, something has caused the skin protection to be broken down. And so that allows the bacteria that would normally be there to cause an infection. So allergies for sure, parasites, seborrhea, which is an abnormal condition where they either overproduce or underproduce some of the protective oils in the skin. And then hormonal disease, so thyroid disease, Cushing's disease, diabetes can predispose to this as well. Again, scratching, chewing, licking, rubbing can be painful. And again, we can see a discharge in or odor in some of these cases. We're going to want to do our physical exam and our cytology. Again, is it yeast? Is it bacteria? Is it both? What type of bacteria are we seeing? And then potentially, we would take a sample from this and do a culture and sensitivity to see what bacteria is present. And this is actually a sensitivity or susceptibility test where they're seeing if these bacteria are killed by different types of antibiotics. So this helps us figure out which antibiotic to choose. So that's going to help determine our therapy, but it can take a long time to resolve. This did not start overnight. This will not go away overnight. And so if it took several weeks to get this point, it's often going to take several weeks to get the infection under control. Again, we want to try to address those primary conditions. And again, if it's a recurring issue, then we might see this over and over again, unfortunately. And then anal gland sacculitis or inflammation of the anal gland. This is something where we kind of have the anal glands, which are on each side of the anal opening. And basically, when the animals go to the bathroom, when they defecate, the stool presses on these glands and it should excrete this nasty stuff onto that stool. And that's how they help mark their territory and communicate and things like that. But with some animals, whether it's allergies causes inflammation, where these ducts are not able to empty properly, or it could be a dog that has that's overweight or has a weird skin fold that doesn't allow these to excrete properly, or very soft stools that don't push on these glands. The material builds up in these glands. It causes inflammation. It causes discomfort. So they're licking, chewing, and scooting. And it can be very painful for them even as they go to the bathroom. And so again, we'll want to do a physical exam. We'll usually do a digital palpation of these to see what we have going on there. But they can get infected. They can even rupture. And so, so really the treatment, usually it's just expressing the anal glands, but we might need to do antibiotics if infected. And if it's as a result of allergies, then we could see this flare up when allergies flare up. And one of the last things we'll touch on would be skin parasites. These there's various different parasites that we can have affect the skin. At the top here, we have Demodex, we have Sarcoptes, which we can see in dogs, and then we have Notoedries, which we can see in cats. And these are infections or infestations where these parasites actually burrow into the skin, often down into the hair follicles. So we can get hair loss, we can get scabs, we can get crusting, we can get very itchy and uncomfortable and can be painful. You can just imagine all these animals just kind of digging around. It's not a comfortable experience for well, we can't ask the animals, but they definitely seem very uncomfortable. So this is where we'll do our physical exam. We'll do our skin scrape to see if we can find these parasites. So we'll scrape the skin, put that on a microscope slide, look at that under the microscope. And then we're going to use the appropriate parasiticide. Most of the common parasiticides will treat these. And so it's nice that we can get resolution with some of the common products out there. And we might need antibiotics if there's secondary infections. But with these, oftentimes we have to treat all the animals in the household because we can see that they can hide in other animals. So we have to be aware of that. And if we're using monthly preventatives, then sometimes that will prevent that reinfestation. When it comes to managing our skin conditions, topical therapies like shampoos and ointments, ear products are very commonly used, especially if it's mild or a local issue, or when it comes to something like atopy or those environmental issues. If we can bathe them with a shampoo that kind of helps rinse things off, that minimizes problems. But some of these products have antimicrobial activity, maybe some antifungal activity, things to help flush the follicles, to kind of help get stuff out of the hair follicles. So we have a lot of options to help manage topically. And then we have topical parasiticides that can help prevent some of those parasites. But then if we have really widespread illness or widespread skin issues or long-standing or really deep infections, then we often need oral or systemic products. So we might need oral antibiotics, we might need oral steroids. There's various oral parasiticides. Apoquel is a product that has anti-itching activity, so it actually can help manage some of these, especially the like atopic animals. Then there are some injectable medications. There are some injectable antibiotics that can be used. Injectable steroids definitely have their use for some patients. And then there's other injections that have some kind of anti-allergy effect as well. So there's a lot of things out there. And what is appropriate for one patient today may not be the same thing we use for that patient a month from now, or a year from now, or 5 years from now, because really we're treating that patient for what we're seeing that day. And hopefully that resolves and maybe we never see it again. But again, with things like allergies, what we see next fall or next spring or the following fall or 5 years from now can be very different. Almost to the end. So want to think there's a few things that I really hope kind of got across here, and things to really help hopefully manage your expectations, and things to think about as we're dealing with some of these skin conditions. So they're often very common causes for us to visit the veterinarian. If you have a dog, you've probably been to the vet for something wrong with their skin. A cat, maybe not as often, but still something that we can see. Many of these skin conditions are very complex and may never truly be cured. So our biggest goal is to minimize flare-ups, keep your pet as comfortable as long as possible, hopefully avoid needing to reach for steroids or reach for antibiotics. But again, oftentimes we're just managing the disease. If you can take pictures, especially with a ruler, and take notes, that's really going to help your veterinarian try to narrow down what the problem is. And we want to work with our veterinarians to help your pet. So again, reach out to them, especially early on, so we can hopefully try to address these issues sooner than later. And be your pet's advocate. If something's not right, look into it. And there's a lot of resources out there, which actually I'll get to in just a second. But it may come down to a referral to a dermatologist. If you've been seeing your veterinarian and you've gotten good results, but things just aren't quite where either of you expected them to be, then it might be that we need to see a boarded veterinary dermatologist for some of these really chronic cases that are just not going how we expected, or really complicated cases where there might be multiple conditions that are being treated. That's where these specialists come into play. But it can be a long wait to see them, so we just have to kind of temper our expectations. And this was true even before COVID. And so seeing a dermatologist, and especially in an area where there's none or one, can even make it more tricky. But thing to consider is that if you are going to go to a dermatology clinic, then we definitely want to talk with our veterinarian or general practitioner before we go see the dermatologist, because there may be some medications we don't want to be given before we see the dermatologist. So skin testing and some other diagnostic tests, steroids or antibiotics might actually interfere with that testing. So we'd want to know that before we go see the dermatologist, so we're not wasting your time, their time, and dragging your pet to the clinic again. And sometimes the dermatologist will say, hey, we can get some diagnostics or treatments done before you can see me, because you may not be able to see me for a month. Let's try some things ahead of time. So we want to work as a team to help your patient, to help your pet, and try to help resolve that as soon as possible. There are some good resources out there. The American College of Veterinary Dermatologists has a listing of local or of dermatologists in the area. Veterinary Partner is an excellent website that I use every day in practice. Talks about some very common skin conditions in animals, and it's written by veterinarians, so it's true information. And a lot of the large groups like VCA and some of the dermatology groups, they have their own websites that have a lot of these resources that go into some of these common conditions. But when it comes down to it, there's a lot of information out there, but we want to look for credible information. So hopefully if it's something posted by a veterinarian, a veterinary hospital, maybe a college of veterinary medicine, typically that's going to be true information, because unfortunately there are times out there where people will unknowingly and hopefully non-maliciously post something of a therapy or something to do for a pet that could actually be problematic or even harmful to the pet. So we want to try to follow the experts there and kind of make sure that we're getting good information. So thank you for your time. Looks like I went, oh yeah, of course I went over because I like to talk a lot. I'm sorry. Any questions at this point? Oh, and actually I do have one here that came in earlier. Oh, where'd it go?
Yeah, there's a few questions actually, Dr. Lewis. So,
oh yes, fire away.
Okay, so one of the first questions we got is there a way to safely clean a cat's ears at home, or does this require a vet's visit?
So when it comes to cleaning ears, it can definitely be something that is potentially problematic. And let me go ahead. When it comes to cleaning ears, we do have to be careful because the animals don't sit still a lot of times. And so if we're not careful, we can actually do more harm than good with our patients. And so typically we want to make sure we're using a veterinary ear cleaner, something that's safe to use in the ears. And typically, I don't want my pet owners using a Q-tip on anything outside of like the outer fold of the ear. Because if you start the ear canal with a Q-tip, if the animal shakes, you can actually damage the ear canal. Worst case scenario would be actually damage the eardrum. And so getting a cotton ball wet, actually that's one of the really easy ways to do with cats and dogs as well, is if you get a cotton ball wet with an appropriate ear cleaner, and you can kind of put it into the ear, and you can kind of fold the ear over it, squish it a little bit. That'll kind of allow that liquid to kind of deep down into the ear, let them shake, and that'll kind of throw out some of that junk, and then you can wipe out as much as you can. But you can only see so far with your naked eye, and so if it's a little bit of dirt and debris, you do that simple cleaning and it's good, excellent. That might be all that we need, and just do that when you notice a little bit of debris build up. But if it's something that you see consistent debris building up, if you notice an odor, if you notice that, hey, I cleaned it, this week, and then within a week it's already built back up again, that tells us there's something more going on. So we definitely want to take a trip to the veterinarian to determine what it is, and then that way we can treat appropriately.
And that question actually was in response to the cat scratching a little bit more. So I would add that if it progresses, then looking a little more carefully for allergies or underlying parasites too.
Yes, because parasites aren't always seen by the visible eye. Uh, that's one of the tricky things is, like I talked about a lot, we want to rule out a lot of these conditions because so many of them look the same. So we want to say, okay, it's not parasites. Okay, it's not this, it's not that. And then that usually narrows it down to allergies. But that way we make sure that we're treating animal appropriately. And that's what can be so tricky at times.
Yeah, yes. And we have another question, and that is, what's the best way to clean pine sap on the paws? Our area has a lot of pine sap, and sometimes this can cause chewing.
Yeah, and that's where it gets that's where it's fun, because every region has their own kind of things. Really having a good shampoo that you can, because you don't have to shampoo the whole dog. You can just get the paws wet, use a good shampoo that has kind of more of a cleansing action, and that can help break up the pine sap, and then you can just rinse the paw and then dry it well. Because that is one thing that we can run into is if the paws are really wet, and especially between the pads on the underside of that paw, if they're really wet, that wetness damages the skin, and that can allow yeast and bacteria to lead to an infection. So you're using a good shampoo that kind of has a good cleansing action, and then drying that paw really well typically works well for most patients. Baby wipes can be very useful, especially if you have an allergic dog. When they come back inside, wipe down the paws with baby wipes. That can do a good job. But yeah, pine tar, that can be a little bit trickier. But you have to be careful, because if you scrub too much, that irritates the skin, and then that can lead to these secondary problems.
Yeah, and definitely fluffy paws. If you keep them shaved down a little bit, then less sap sticks to them. That's always a nice thing too.
Yep. Yes,
So,
for sure.
and I shame on me, I didn't say thank you very much at the beginning to Vetoquinol, who is our sponsor tonight, and also the organization that you work with. And you guys do have quite a few shampoos and products that could be used for these types of things, correct?
Yes, we have everything from aloe and oatmeal, which is great for just kind of general hydration of the skin, and has the oatmeal to give it a little bit of an anti-itch for some of these really mild, kind of itchiness from allergies. But we also have medicated products that have antifungal activity. We have things that have a cleansing action for those hair follicles. We have multiple different types of ear cleaners. So we do have a pretty broad range of products to try to support our veterinarians and you as pet owners to try to treat each patient appropriately. And I kind of on that note, there's a lot of shampoos out there. There's a lot of ear cleaners out there, because each of them often have different combinations of ingredients that are targeted to that specific thing that we're dealing with. So that's where I kind of mentioned at the end there, what we're treating today may be different than what we treated a month ago or a year ago. So if you have a shampoo and you've used it for a period of time, hold on to it, because you might need it again later. But that's why there's so many out there, because it allows the veterinarians to choose a product that is appropriate for that patient that day. And that's why it can be a little daunting, but that's where hopefully your veterinarian will help you kind of determine which product's going to be best.
That's a really valuable point. And so one of the questions I was going to ask is that my understanding, and again, this is an internist who doesn't do a lot of dermatology, is it true that there are some so that a general practitioner could do some testing for atopy if a dermatologist isn't available? Actually, on the Central Coast right now, it's somewhere between 3 and 4 months to get to a dermatologist, which is really frustrating for some of the clients that want to get in to see them. And so is there resources that could support a general practice to help with atopy testing?
So there are some blood tests that can be done. to look for some of the common allergies. It just gets a little tricky because um, the dermatologists prefer the intradermal skin test, which is similar to what they do with some people, where you actually inject the allergen into the skin and measure the response to that patient because it does give a more tailored response. There are blood tests that can be done that checks for allergens in patients, and they often correlate pretty well with what we see with that patient. But there have been times where a blood test and a skin test has been done on a patient, and they didn't have the same result. So if it's several months from being able to see a veterinarian, the the blood test can be done, and it often is helpful. But if you talk to a dermatologist, the skin test, the intradermal skin test, is the preferred method because their confidence is much higher in that test than the blood test. But the blood test is something that a general practitioner would be able to do, and especially if it is a long time out, might be able to help kind of guide therapy before you're able to actually get to a dermatologist.
Thank you. Thank you for answering that.
Yes.
And then one of the other questions that I have, because and everybody who's out there, you're welcome to add more questions. Do you recommend something like a HEPA filter if you think that there's an environmental allergen affecting a dog?
Those help a lot. So just like with us, if we have allergies, the better air filtration system that we have in our home is definitely going to help remove as much of those, as many as those of those environmental allergens as possible. So yes, a good quality HEPA filter, vacuuming often, dusting often makes a big difference because if we can remove as much of the allergen from the environment, that reduces the exposure of that patient. And then for dogs, if it's an environmental allergy like pollen, then after you go out for a walk, wiping down their paws with baby wipes, even wiping down their hair, just kind of like a damp washcloth or something on their hair. If we can mechanically remove those pollens, it reduces the ability for that pollen to actually get down to the skin and cause that kind of inflammatory response. So just simple, baby wipes on the paws, wiping down the body, and doing a simple bath weekly or twice a week or kind of as appropriate for your patient or for your pet. Those are things that can hopefully minimize some of those flare-ups.
Great. And in the beginning, you did a great job listing the terminology that veterinarians throw out there, forgetting that the definition isn't something that every client already has. So HEPA stands for high efficiency particulate air filter.
Yes, I believe
Right?
so. Yep.
So
And
that was mea culpa there, just throwing out the word HEPA.
yep.
As an internist who does a lot of upper airway and airway issues, I feel like the HEPA filters are a huge part of decreasing particulate matter that might trigger allergic bronchitis and things like that in my patients as well.
Yes, and when it comes down to it, if a person can be allergic to it, so can a dog, so can a cat. I guess cats are probably lower on that list, but they can be. And that's where it's interesting when some of the skin testing and some of the allergy testing is done. There's times where a dog is allergic to human dander. And it's kind of like, well, it's not like I'm not going to pet my dog anymore. We just have to be aware that we want to bathe regularly and do these things to help minimize some of that exposure.
Yeah, I think it was fascinating when some of the newer treatments for the environmental allergies or atopic atopy that we found the receptors, that there were specific receptors in areas. And as you said, wiping down the feet and the body of the dog can decrease the trigger of those receptors that are going to fire off the allergic response.
Yeah, and that's the tricky part is what is the level of exposure that triggers an inflammatory response for a dog? It can be different from one dog to the next, but over time, that level of that threshold for triggering that allergic response can get lower and lower for that same dog or cat. And so, what the allergy might have been when the dog was 1 or 2, sometimes it can get worse with time, and so they can be more reactive with even less exposure, and new allergies can develop, just like with people. And so it's one of the more frustrating things we deal with because we don't cure them, we just manage them. But we do have a lot more tools between Cytopoint and Apoquel and better understanding of how we can manage these patients. And even, some of like the oral antihistamines aren't used as much. They can still be beneficial for some patients, but we're finding that they're not as effective as we once thought. So there's a lot of things that we learn as time goes on, but we do have a lot that can be done to help these patients.
Great, great. So actually, there's not any other new questions coming in. I didn't know if did you want to try to address we
Yes.
had a pre-emailed question to someone who was working the polls in California, so couldn't be here live. And I can certainly summarize it if you'd like.
Yes, I did find it here. Sorry, I'd had it pulled up initially and then it went away on my phone.
No, that's
So the pet owner has a 13-year-old dog that she adopted from a rescue and was on Apoquel, which is an oral product that helps reduce itching. It had terrible yeast infection. She has recurrent issues with oiliness, redness on the skin, even black areas on the skin. She bathes regularly, tries to use shampoos, has used various medicated shampoos from the veterinarian, and has done Cytopoint as well. They're using an appropriate flea parasiticide product, and they've done several different foods. And it sounds like the patient did well for years.
Uh-oh.
And then has these flares. And this is a patient. Oh, did I cut out?
Yeah, you cut out for a minute, but
Am I still there?
yeah, you're there.
Okay. Sorry, the hotel has spotty reception. So this is a patient where, and unfortunately, this is not an uncommon thing when we're dealing with skin conditions, especially when an animal has had chronic skin conditions. And so, kind of based on the information provided, this animal likely has allergies because there's a seasonality to it. Has responded to some of therapies that typically help manage allergies, but it never completely cleared up. And so with kind of the description of there's some oiliness, some scaliness, and some kind of flaking, that actually might be a condition called seborrhea, which I mentioned briefly, which seborrhea is basically where there's an improper secretion or balance of kind of the oils of the skin. So there's seborrhea oleosa, where there's an overproduction of this oil, and that causes greasiness, and that creates an abnormal environment. It shouldn't be that greasy, so that can allow yeast or bacteria to cause an infection, can cause itching, scratching, and everything that we're seeing. Then we have the other extreme, which is seborrhea sicca, or dry seborrhea, where there's a underproduction. So we can get dry skin, we can get flaky skin, and it's not normal skin, so that can lead to infection with yeast or bacteria or both, and make them more apt to be itchy and scratchy. And so this may be a dog that has a seborrheic condition, whether it's oleosa or sicca, likely has environmental allergies, doing their best to manage with allergy, but it could be food as well, could be thrown in there. And then with an animal getting older, then we always worried, is there a thyroid issue that's being involved, that's developing? Could there be something like Cushing's, which is an underproduction of some of the steroid hormones? So there's, with some of these patients, it may be that it was allergically, and over time, and as the animal aged, other things have developed. And age is not a disease. It's just, unfortunately, a lot of things start to go wrong the older we get, just like us. And so it might have been what worked initially has now changed because the animal's body has changed. New conditions may have developed or may have worsened to the point where things aren't normal in the skin. And when things aren't normal, it allows these secondary infections. And it doesn't have to be smelly or funky for there to be an infection. And in a case like this, it can be frustrating because this dog may never be quote unquote normal. Our goal for this dog would be, okay, we're going to try to get the skin as healthy as possible to the point where we can minimize the frequency of flare-ups and hopefully not have to rely on antibiotics or antifungals or systemic steroids or these other things to keep that animal comfortable. That said, we may never get to that point. It may be that, okay, we're doing well, and then we have a flare up in the spring and fall. We manage it at that point. If it's a year-round issue, then we're dealing with those kind of ups and downs that we see there. But it can be very tricky. It can be very frustrating, and that's a patient where it sounds like you've done a lot for that animal and have done a lot of great work there, but that dog might need another workup to, again, with blood work to check for some of these metabolic issues, might need some cytology done to see is it yeast or bacteria or both, might need a culture and sensitivity, it might need another diet trial because new allergies can develop with time. And with some of these animals, it ends up that you need a biopsy to truly determine what that problem is, because there are some weird cancers that can affect the skin. There are some other kind of autoimmune diseases that can develop. So like I said, today was kind of a higher level when it comes to talking about some of the conditions, because dermatology can get very tricky.
Yes, it can be quite the slippery slope sometimes. Yes, I agree. So we had one quick question about mosquito bites, and is Benadryl an appropriate thing to use in a short-term allergic reaction?
Yes, Benadryl is something that, as an antihistamine, it can be used for an allergic response, and something that the biggest thing is if we're using something over the counter, we have to be careful because animals are not people. So we don't want to use any of the antihistamines with decongestants or other things added. We would just want to stick with a straight antihistamine, and the dose depends on the size of the patient. So that's something I won't get into over this because that is not appropriate.
Yes.
But that's something that you could reach out to your veterinarian to get an idea. But yes, Benadryl can be used to help with some of those mild types of things. But if it's like a really bad seasonal allergy, Benadryl might help some, doesn't help others. If it helps, great. If it doesn't, well, there's other things that we can try.
Yeah, and that's, I think, when you should go into the vet, right?
Yes, because if it's just one little bite and it responds, great. If we're seeing multiple bites, if we're seeing that it doesn't respond, or if we're seeing things just aren't quite responding, yes, we definitely need to see our vet.
Great. So 2 more quick questions. One, you mentioned a high IgE level. How is that evidenced? And you were referencing the blood test at that point, correct?
Yeah, so that was with atopy. So atopy is just an IgE is some of the immunoglobulins. So that just indicates that there's a heightened immune response to whatever that trigger was. There are blood tests that can be done. Typically, when we're doing the allergy testing, it's along those lines, but slightly different.
Okay.
If that makes sense.
It does. I think that this attendee was asking about the IgE level, and in reference, you were saying that it's one of the things documented in dogs with atopy,
Yes.
as opposed to a specific thing that you would test a particular dog for.
Correct. Yes.
Okay. Great. And I don't know how to answer this question, but somebody's saying, how effective can acupuncture potentially be in treatment plans? And
so that's an excellent question. So I will say that I am a Western trained veterinarian. So I have not been through acupuncture training, but with my job, I get to travel around the country and talk with a lot of amazing veterinarians. And with those that are trained in traditional Eastern medicine, traditional Chinese medicine, they do see that acupuncture can be beneficial for those patients. Is it going to cure an allergy? No. Is it going to stop the problem? No. But if it can be used to access those trigger points and to calm, I don't use the same terminology that they use, but if it can calm those areas that are being affected, then it has been beneficial for those patients. But is it a long-term cure? No. But it's something that if it's something that you're comfortable doing, if your pet is comfortable doing it, then it can be beneficial. but often we are still dealing with whatever that underlying trigger was that caused the problem in the first place.
Great, thank you. And we're going to make this the last question. If a dog is prone to yeast, can a grain-free diet be helpful? That's a very loaded question. I'll preface your answer with that.
So, so the yeast that we deal with in the skin is yeast that is present on the skin or from the environment. And so it is not something that gets to their body through the food. So the yeast that causes those skin infections from the environment, it's an external access to the skin. So it wouldn't be directly from the diet. It's just if an animal has a sensitivity to something in the diet, and grain, some of the carbohydrates can potentially be a trigger. So and here goes my allergies kicking in. So a grain-free, the grain-free diet, if the grain is part of the trigger for the food sensitivity, by removing that trigger, then that should greatly reduce, hopefully eliminate, but more than likely reduce the inflammatory response to the food, which reduced inflammation means reduced likelihood of a secondary infection. If the grain is the food trigger, it will be helpful, but it's not directly related, if that makes sense.
Yeah, I think that's a good point. And I think I always think of it as it's all a trial and error. And
Yes.
One of the important things is making sure that you just change one thing at a time so that you can document where the difference is made.
Yeah.
So,
and one point on to your point about when we're doing a food trial, if a dog is allergic to chicken, it can be a morsel of chicken that big that can trigger that inflammatory response. So if we're doing a true diet trial and we've eliminated chicken, we have to be careful about table food, treats, even some medications and other things that might be chicken flavored, because one little morsel of chicken can be enough to basically counteract what we've done with that diet trial. So when we're doing a diet trial and we're doing 8 to 12 weeks, we have to be really diligent, because if we have people visit or the dog gets something off the ground when we're walking, or we inadvertently give it something that has whatever that trigger is, then we may have just shot ourselves in the foot and we have to start over with that whole process.
yes. Well, thank you so much. I thank you, Dr. Lewis, for lots of information, and I think the perfect amount to absorb and not overwhelm us. So thank you. That was well done. And thank you very much, Vetoquinol, for sponsoring. And definitely everyone who's out there, take a look at some of the products they have to help support skin and other things in your pets.
Thank you for your time, Dr. Birch. I really appreciate it. It's my pleasure to chat with everyone tonight. And yes, definitely thank you for your time and attention.
Thank you. Take care.
Okay, you too.
Bye-bye.